Hi, my name is Heather and I'm a clinical psychologist here at the Great North Children's Hospital.
My name is Lindsay and I'm also a clinical psychologist at the Great North Children's Hospital.
This video is for parents and carers whose children are currently admitted onto the Paediatric Intensive Care Unit, which is also known as PICU. The aim of this video is to talk about the different feelings people might have at this difficult time and to think about helpful coping strategies.
Having a child admitted onto PICU can be very stressful. Parents and carers tell us that they often feel sad and upset, guilty, anxious and worried, angry and irritable, like things aren't real. Sometimes they can feel lonely and sometimes numb and withdrawn from the world.
Parents and carers also tell us that they might have trouble sleeping or have nightmares, find it hard to concentrate on things, and sometimes feel in denial about what's happening to them. All these feelings are very understandable given the situation that you're in. Also, life goes on outside of the hospital. People still have work or maybe looking after other children. There might also be financial worries.
Parents and carers can experience a whole range of different reactions to what is happening. They might feel that part of them wants to run away from what's happening, even though they don't want to leave their child's bedside. You might find it hard to take in information and concentrate on anything. Sometimes people feel angry about what's happened and can replay events over and over in their minds. These are all normal responses your body has due to being under immense stress.
It's so important to look after yourself when your child is on PICU. This means you're then able to take care of your child and be there for them as best as you can. Ways you can do this include things like taking regular breaks off the ward, maybe stepping outside the hospital for some fresh air, trying to eat and drink when you can, talking to people who you find supportive, such as family or friends, talking to the staff about how you're feeling.
Try if you can to stay in the here and now. Your mind might be going over things that have happened already or thinking what if about things that might happen in the future. Notice when this is happening and then try to bring yourself back to the present moment and what is going on right now. If you can, go for a walk each day and focus on the things you can see and hear and touch. There are lots of apps and YouTube videos that talk about mindfulness and relaxation that you might find helpful.
Try and keep to a routine, getting up in the morning and going to bed at night at around the same time. Come to hospital and leave at about the same time each day, and try to have fixed regular meal times. This isn't always possible, but you can only try your best. If you can, nominate a link person, a friend or family member, who can respond to messages from people who are wanting updates. Don't feel that you need to reply to every message. Try and get someone else to do it on your behalf.
Don't be afraid to ask questions about what's happening, and if you don't understand the answer, ask again. There's no such thing as a stupid question. If you have any questions or worries, write them down either on a notepad or on your phone so that you can remember them when you speak to the doctors and the nurses. This can be helpful when you have a lot going around in your head at night. It can help to get involved with your child's care, maybe washing, brushing hair, getting clean pyjamas on. It's really normal to feel anxious about getting involved. Speak to the staff and they'll be able to support you.
We hope that you've found this video helpful. The unit has access to the chaplaincy team and hospital social work, and they're there to provide emotional and practical support to anyone who needs it. Please speak to a member of staff if you would like to access that support.